be a student nurse today. I'm at the University of Detroit Mercy. I'm going to close your curtain for some privacy. I'm going to wash my hands real quick. Okay, sir, can I see your wristband?
Yeah.
Can you state your name for me?
Josh Vergoven.
Your date of birth?
12/30/94.
Okay, great. Do you know what today is?
It is a Thursday.
Okay. And what year is it?
2015.
Alright. And what are you doing in the hospital today?
Just here for routine checkup.
Okay, great. Patient is alert and oriented ×3, has good affect, good posture, appropriate responses. Patient appears stated age and has no obvious signs of illness. Are you experiencing any pain today, sir? No? And do you have any allergies? Okay, great. Alright, so I'm going to start off by assessing the head and checking for any lesions and hair distribution. Hair distribution is even, no lesions in the hair, appears healthy, hair is thick, skin in the face is intact, healthy, warm, appears normal to ethnicity. Okay, I'm going to start by assessing your eyes. Can you take your glasses off for me, sir? Okay. Okay, eyes our pupils are reactive, equal, round, and reactive to light. Can you look at this for me, sir? And are accommodative, they're round. Okay, can you open your mouth for me, sir? Okay, the oral mucosa is healthy, intact, oral hygiene is good. Can you say ah for me, sir? Ah. Uvula retracts, tongue is healthy, tonsils are +1, and gums are pink, and overall looks healthy. Good hygiene. Okay, can you look at me, sir?
Yep.
Can you smile for me? Can you frown? Okay, can you puff your cheeks out? And can you raise your eyebrows? Okay, cranial nerve 5 is intact. And can you close your eyes for me and tell me where you feel these?
Cheek. Other cheek. Swelling.
Okay, great. Cranial nerve 7 is intact as well. Okay, now I will begin assessing the carotid arteries for pulse. Okay, carotid artery is 2+ and bounding. Okay, now I'm going to also take the carotid artery with the bell. Can you take a deep breath when I ask you to?
Yeah.
And hold it, please.
Yep.
Okay, take a deep breath. Alright, no sounds of brewing. Now I'm going to begin with the chest assessment. Skin on the chest is intact, no scarring, no signs of lesions, it's healthy. Okay, so I'm going to start off by listening to the aortic artery. Okay, the aortic artery is in the second intercostal space. And the pulmonic, and the Erb's point, is in the third. Pulmonic is in the second. Tricuspid valve, which is in the fourth. And the mitral valve in the fifth. Okay, now I'm going to also take the mitral valve for 60 seconds to get the pulse. So I would do that. Okay, and then I'm going to listen with the bell in a reverse pattern that it came down with, all the way back up. Erbs. Okay, yeah, heartbeat is regular, no normal rhythm. S1 and S2 are clear, S2 is very loud. Okay, now I'm going to listen to your lung sounds, sir. So could you take a deep breath when I ask you to, please? Okay, deep breath. Alright, and I'm going to assess that in 10 places. So I continue. 3, 4, Okay, now I'm gonna listen laterally as well. Okay, take a deep breath for me, sir. Okay. On this side. Okay, great. And now I'm gonna listen to 10 places on the back as well. So can you take a deep inspiration for me, sir?
Alright.
Great. And one more. Alright, and I'm gonna listen to 8 more places as well. 2, 3, 4, 5, 6, 8. Okay. Lung sounds are clear and no adventitious sounds in the lungs. No labored breathing. Okay, so now I'm gonna assess the abdomen. Can you lay down flat on your stomach, on your back, please, sir? Okay. Abdomen contour is flat, stomach is round, navel is center and midline. Okay, so now I'm going to inspect the abdomen for any lesions. Skin is intact, no scarring, no lesions, is healthy overall. Okay, so now I'm going to auscultate for bowel sounds in all 4 quadrants. Okay, bowel sounds are present in all 4 quadrants. If none are heard, then you listen for 5 minutes. Okay, now I'm going to percuss for tympani. So, right upper quadrant is dull due to the liver, and the rest are tympanic sounding. So now I'm going to palpate each quadrant. In the right lower quadrant, you have, I'm going to palpate as well. You have the appendix and the ascending colon, the spermatic cord, and the ureter. In the right upper quadrant is the liver, the gallbladder, the tail of the pancreas, and the transverse colon as well. In the left upper quadrant, we have the head of the pancreas, the stomach, the spleen, and also the transverse colon. And in the left lower quadrant, we have the descending colon, part of the sigmoid colon, the left spermatic cord, and the left ureter as well. Okay, so when we palpate, we go about 1 inch deep, and I feel no organs out of place. Okay, so you can sit up for me, sir. Okay, anterior, posterior is 2 to 1 ratio. Now I'm going to test the costovertebral angle for any pain. Can you tell me if you have any pain, sir?
Yeah.
No? Okay, and can you stand up for me real quick so I can assess your spine? Can you bend over, please? Okay, great. Okay, while you're here, can you, while I have you standing up, can you walk to the board and back for me, please? Sure. Great. Alright, gait is stable and appears normal. You can stay standing up for a minute. Can you close your eyes for me for 30 seconds? I'll test to see if the patient has any swaying, and this is the Romberg test. Okay. Patient passes the Romberg test, no swaying. You can sit back down, sir. Okay, I'm going to look at the upper extremities and arms. Skin is intact, no lesions, is cool, normal to ethnicity. Okay, and the capillary refill is less than 3 seconds, and skin around the fingernails is intact. Fingernail beds are pink, no ridging on the fingernails, and can you go like this for me, sir? And no clubbing as well. Okay, now I'm going to check for the radial pulses. Radial pulses are uniform bilaterally, and the brachial pulses are uniform bilaterally as well. Both are 2+. Okay, so now I'm going to check for the popliteal pulses. They're behind the knee. 2+ and uniform bilaterally as well. And then I'll check for the tibial pulses. Can you take your shoes off? Yeah. plus and uniform bilaterally as well. Hair distribution on the legs is good. No obvious signs of like scarring. No cuts or lesions on the skin. Like I said, hair distribution is even. No, appears to have no edema or swelling in the ankles. I'll check for the dorsal pedal pulse. Uniform bilaterally and T plus as well. Capillary refill on the toenails is less than 3 seconds. Skin around the toenails is intact. The nail beds are pink and no signs of clubbing and ridges. Okay. So I believe that completes my